everyone. Welcome to our new session entitled Movember. We are glad to have with us Dr. Guilherme Godoy, Assistant Professor, Urology at Baylor College of Medicine, Houston, Texas. Welcome, Doctor. We are thrilled to have you with us today.
Yeah, thanks so much for having me.
Doctor, today we are going to shed the light on prostate cancer. We know that according to American Cancer Society, prostate cancer is the second most common cancer among men, and it kills more men than breast cancer kills women. So can you tell us first, what is prostate cancer?
Yeah, so prostate cancer is a very prevalent disease. It's a tumor, a malignant tumor that grows in the prostate, and it's a very prevalent disease. It's the most common cancer in men here in the United States, and but it's very prevalent all over the world as well. So it's a very important disease to keep in mind for men.
Mm-hmm. And doctor, when should the men start getting checked or screened for prostate cancer?
The overall recommendation, it's around 50 years of age. You should have a prostate check, you have a rectal exam, and there's one blood test. It's called PSA, the prostate specific antigen. That's how we start, screening and testing for prostate cancer. If you have risk factors, and the risk factors include family history with other members having prostate cancer, or female members in your family having breast cancer, or if you're Black or African American, you have a probably higher risk. So for those, we recommend an early test around 40-45 years of age.
Mm-hmm. And what is the relation between breast cancer and prostate cancer in the same family?
Yeah, we've known this relationship for a long time, and more recently we discovered genes. They are associated to both diseases. So for example, there's a gene called BRCA, BRCA1 and 2, more importantly BRCA2. It's a gene that is involved in both diseases. So then if you have mutation on that gene, you could be predisposed or have a higher risk of developing prostate cancer, and the same goes for the females with a higher risk of a breast cancer. So the diseases are related on a genetic level.
Okay. So what are the early signs that men should look for when it comes to prostate cancer?
That's the important thing about prostate cancer. It does not give early signs or symptoms. So that's why it's important to stay on top of it and do checkups and check with your doctor, go see a urologist, check your PSA and do prostate exams, because the tumor grows in the outside portion of the prostate, so it would not cause urinary symptoms. A lot of men have urinary symptoms as they age, but this is because of a benign condition that we call benign prostate hyperplasia, which has nothing to do with cancer. It's a completely different condition. So prostate cancer in the early phases, they are silent. That's why it's important to do the check and the prostate exams and the PSA, because you can catch early before it gives any symptoms.
Mm-hmm. And are some men are more likely to be diagnosed with prostate cancer? For example, race or age. We know that age is a major risk
factor. Yes, yes. So you're right.
Any other risks?
There are risks. So we know men, as they age, their risk increase. It can get up to 1 out of 6 men over the course of their whole life, they might have prostate cancer. Doesn't mean it's going to be an aggressive cancer, but it's a very prevalent disease. So as you age, the higher the risk. Race is associated as well. So Black men or African American men, they not only have a higher risk of having cancer, but they also have a higher risk of more aggressive cancers as well. And as I said, family history, and now we know some genetic factors. We can even do some genetic testing with those men with important family history, and we can identify those risk factors as well. And the difference is, in those men, we tend to recommend early tests and a little bit more frequent testing to make sure we can catch the disease at early stage if it occurs.
Mm-hmm. So, doctor, can you tell us about the screening? What are the procedures for detecting prostate cancer?
It is very simple.
Kind of screening? What are
Yes, yes, it's very simple. We don't, offer populational screen programs. It's a little bit of a controversial topic, but of course, I think every man needs to be evaluated when they get to those age cutoffs that I mentioned, and the evaluation is actually quite simple. You should visit your primary doctor or a urologist. Urinary symptoms need to be checked. We need to examine the prostate. That's a quick physical exam. When you feel the prostate of our finger to the rectal exam, it takes just a few seconds and give us a lot of information in terms of the size of the prostate, if there's any nodules, any areas that are suspicious for cancer. And there's a blood test. There's called PSA, the prostate specific antigen. It is also very simple, readily available anywhere, and it can inform if there are any risks or if the test is elevated, and then further tests can be done after that.
And Dr. Gino, do you think that awareness for prostate cancer is already out there? The men are familiar with this screening, or we need more work on this?
I think we need more work on this. I think the women are a lot more on top of their health, and they go to do regular checks for breast cancer, for cervical cancer, and they have regular visits more often than men. So it's important that men also create that habit, create the routine of go for regular checkups. And part of the checkups, just like we do for colorectal cancer, you do colonoscopies after a certain age, and you do blood work to check for diabetes, you check your blood pressure. So checking the prostate should be something routine. And as I explained, it's very simple. A quick blood work and a quick component of a physical exam that is fast and completely painless will give all the information that you need.
And doctor, what about prevention? Is there any way to prevent prostate cancer? What can you tell the men out there about prevention?
Yeah, there's been several studies, looking to diet and vitamins and supplements and a lot of other things, nothing being really confirmed to prevent it. What we do is really tell the patients to have a healthy lifestyle. So everything that we, already heard multiple times. So healthy diet, avoid excess of fat and red meat and red protein, exercise, good sleep, avoid stress, excessive alcohol, avoid cigarette smoking. So all those things will promote overall good health in your body, and that will also help for the prostate. There's nothing really specific that can prevent it, but we can doing these regular checkups, we can catch early. Not every cancer need to be treated. Some cancers are less aggressive and more indolent, so they can only be observed. They only need to be observed. But the ones that need to be treated, if they're caught early, you can really cure and get rid of the disease early.
And doctor, we know that it's a concern for men because prostate is related to their sexual life. So does prostate cancer affect the sexual ability of a man?
Yeah, that's a good question. At early stages, it does not, and you might hear that the treatments might cause side effects, and can impact sexual function, can impact your urinary function. And this is true to a certain degree. It really depends of what treatment is offered and how the treatment is managed. The important thing to know is, again, not the screening itself doesn't affect anything. So going and being tested and getting yourself all there, that will not affect anything. And even if you have a diagnosis of prostate cancer, there's a broad spectrum of the disease. So in the lower end, the less aggressive cancers, you can only follow and monitor. They don't even need to be treated, so you have no side effects. The more aggressive ones, you need treatment, and every treatment has some side effects. But in the other hand, you having the cancer detected early and cure early. And for all those side effects, there's also treatments. So if there's any impact to sexual function, urinary function, you can always treat that as well.
So early detection is the best way to avoid complications in the future.
That's correct. The earlier you get, the easier it is to treat it and to get rid of it with good outcomes.
So is it curable? Can we say
many times, yes. Many times, yes. And again, the early detection is the key. Some of these cancers are aggressive, and even if you catch early, it progresses quickly and requires more treatment. But you know, depending on the stage and how early you get, this may be curable. Yes.
So can you give us an idea about what are the latest treatments out there for this kind of cancer?
Yeah, so the treatments they vary. Again, it can go from observation and just monitoring. Some patients, they have indolent cancers, they'll never progress, never cause problems. They don't even need treatment. If they need treatment, varies between surgery for removal of the prostate and the lymph nodes in the pelvis that can be done differently in a different ways. Can be open, laparoscopic, robotically, and there's radiation therapy modalities as well. Radiation can be offered with external radiation, can be offered with implantation of a radioactive seeds that burn the prostate from inside, associated with some hormones. We know that the prostate and the prostate cancer feeds from testosterone. So we also complement with hormonal treatment to decrease testosterone levels and starve the tumors, make the tumor more sensitive to therapy. And there's combinations of all these therapies that I mentioned. On more advanced stages, then we can use immunotherapy, we can use chemotherapy. There's other things that we use to treat the whole body in combination with the hormonal therapies to treat the different stages of the disease.
Mm-hmm. And what are the chances for recurrence in this kind of cancer?
It again depends on the stage. If you catch early at an early stage, you have a higher chance of being free from disease with a single modality treatment, either with a surgical treatment or the radiation therapy treatment. If you detect the disease at a higher stages or a disease that's a little more aggressive, then we require multidisciplinary, a multimodality treatment, meaning a combination of the different treatments, surgery, followed by radiation hormones, or starting with a hormone radiation followed by surgery. So we combine the modalities, and the important thing to understand is that prostate cancer overall, it's a slow growing disease. It's a slow growing cancer. It's not a cancer that will progress too quickly, and you need to act really urgently. So we have time to do the tests that we need, to have the treatments that we need. And many times the patients, they got into remission and they stay, you know, disease control for years. So even if patients with have recurrent disease or more progressive or aggressive disease, if they respond well to hormonal therapy, they can remain free from disease and well for many, many years.
So, doctor, is it you are saying that it's genetic also? So, if a father, for example, in a family has prostate cancer, what are the chances for the boys in the family to get it?
Right. So if you have a direct family member, meaning a
Yeah.
brother, father, an uncle, you know, paternal uncle, your risk of having prostate cancer increase at least 3 to 4-fold. Some people say it will be even higher per member.
Okay.
With the family member that have the diagnosis. So when we have some criteria, and if you meet that criteria, we do genetic testing these days, and then we can test for the, you know, some genes that we know are associated to that. And the importance is that we not only understand what's causing the disease, but also we can verify if there's a hereditary type of cancer running in the family. And this is important to inform all the other members of the family, including the females, you know, their potential risks of developing prostate cancer, breast cancer, and some other cancers as well, depending on the genes. So this is important, so we can cascade screen the whole family and inform risks, so everyone at risk can, you know, start doing the early screening and early tests.
So early, you mean at what age? So we know that men should start at 50, but if they have a higher risk, so they should start at what age?
At 40.
40, okay.
40 to 45, that's the recommended age to start if they have these risk factors or you know, found gene or hereditary cancer. You know, prostate typically happens in an older age, so you know, 40 is typically a good age to start if they have risks.
Okay, great. So the last question, doctor, what is your message for the men out there? regarding prostate cancer.
Yeah, so I think the message is, don't be afraid. I think it's important for everyone to be aware of the disease.
Yeah.
It's the most common, is the number one cancer occurring in men. So it's important that everyone is aware, everyone knows how to detect, everyone is familiar with the screening and what needs to be done, at age needs to be done. They know their family, they know their risks, and they keep a good contact with their doctors. And when in doubt, go visit your primary doctor, go visit a urologist, and you will see the test is very simple. It's painless, it's quick, and then if you're free, you're good. If you have something that is abnormal, you can do further tests, and if you catch it early, you have the best chance of getting rid of it.
And there's nothing to be ashamed of also, because men
Absolutely,
yeah.
absolutely. There's
It's
if there's a little
issue.
yeah, there's a little bit of concerns and a little bit of cultural it's not a shame, but the man is a little bit hesitant about doing the test. And it's just like any other physical exam, any other physical test is very quick, and again, doesn't hurt, and it's very important. Your health is at stake, so it's an
The
important thing to do.
priority. Yeah, sure.
Exactly. Yeah.
So thank you, Doctor, for your time and for the information you gave us. So a message for all the men out there: stay aware and stay protected and get checked. So this is
Exactly.
our message to you. Thank you very much, Doctor. It was a pleasure.
Yeah, thank you so much. The pleasure was mine, and thanks for having me.